Hello there, and welcome. I'm going to be your doctor today, and we're going to do the cranial nerve exam. Make yourself comfortable. Please take a seat. I'm just going to put some gloves on. Please make sure that if anything feels uncomfortable or maybe even a little bit ticklish during this exam, you'll let me know, okay? Everybody's a little bit different, so we're going to start this with your hearing test. Okay, so what I'm going to do first is cover one of your ears and slightly whisper some numbers into your other ear. What I want you to do is to repeat after me if you got it, okay? Perfect. Let's start. So firstly, I'm going to be covering your right ear and whisper into your left. Ready? Perfect. 30. Okay. 49. Perfect. 18. Did you get that? And the last one. 13. Perfect. On the other side now. 31. Unintelligible. Okay, let's try again. 31. Perfect. 27. Good. 43. Perfect. Okay. And I would like to know if you have been experiencing any type of issue, any pain, maybe difficulties sleeping on either side, any high-pitched noises? No? Perfect. Now, I'm going to use this. It might be a little bit ticklish, so I'm going to apologize in advance for that. This right here has a little cam, which will allow me to see deep into your ear canal, okay? So, I'm going to introduce this into your ear. Just relax, okay? If at any point this starts to feel uncomfortable, I'm going to stop, but trust me. Okay. So, you're going to hear a noise, okay? Like a high pitch sound. Let me know when you hear it. Perfect. Alright. So, I'm just going to like that. Okay, let's see. Alright. And you should start hearing the sound soon. Is it continuous? Okay. Okay, perfect. Now on the other side, okay? slowly. Alright. Just a little bit. You know it's ticklish, yeah. Okay. And you should start hearing the sound. Just a moment. Perfect. Everything seems fine with your ears, okay? No irritation, no blockages, everything is fine. So let me just look at the results. Okay, and there is one little thing I want to do, just to make sure, okay? I'm just going to wrap my fingers like this. And I want you to tell me from which side do you hear that coming from, okay? Good. Left. Both. Right. Good. Alright. So, up next, I'm going to check your vision. This is going to be very, very nice, I promise. So, firstly, I have some cards right here. On each card, there's a number or maybe a shape. If you're able to distinguish what is asked correctly, we're good. So let's see, okay? We're going to start with the first one. Which number do you see? Okay. The next one. Okay, good. Just two more, okay? 74, correct. What about this one? So that's it. And the last one. What shape do you see? A square, correct. Perfect. The next thing we're going to do is see how your eyes react to the light, okay? So, right here. Back at the chart, please. Once again, right here. Good. On the other side, please. Look right here. I'm going to shine this straight into your eye. Okay. Good. Now we'll switch to a softer light. This is more like a yellowish tone, and it's not that bright, okay? I'm going to do some shapes, and I want you to tell me what shape it is, okay? Are you ready? Okay. What shape is this? Good. What shape is this? Good. What shape is this? Good. One more. What shape is this? Good. What about now? Perfect. And good. Do you see the light clearly? Can you focus on it? Focus on the light and not on my fingers. Okay. Good. Perfect. Let me just go with this light down. Okay, I'm going to lift a little bit more. Like that. Beautiful. On the other side. Just a little bit. Observe that. Perfect. That's great. Very good. I mean, look in this result. And now I'm going to cover one of yours. I'll get back to the light soon. Okay, let me just cover one eye. How many fingers am I holding up? How many fingers? What about now? Perfect. Let's switch sides. How many fingers? How many fingers? Okay. And the last one, how many fingers? Alright, perfect. Okay. Now I'll bring back the light and I'm going to shine this into one of your eyes and see how both of your pupils react, okay? I'm just going to lift your eyelid a little bit. It's not going to be uncomfortable, I promise. Okay. So we're going to start with this one first. And I'm just going to lift like that. I want you to look at the light. I'm just checking to see how your eyes, your pupils react to this. Everything seems fine. Just one more time. Follow the light with your eyes. Perfect. Let's go ahead to the other eye. So I'm just going to lift like that. And now slowly bring this into your field of vision. Like that. Alright. Perfect. Alright. One more little test. I'm just going to hold up and show you some numbers. And this time I want you to quickly answer, okay? As quick as you can. Perfect. Now, how many fingers am I holding up? Okay. How many fingers am I holding up? Good. Now. Perfect. How many fingers? Good. That's just great. The next thing I want you to do is please focus on the eye chart behind me. Just keep looking at the chart, please. And now look at the light. Look at the light, please. And back at the chart. Perfect. We can move on. Alright. So, the next thing that we're going to do is check your facial sensations and your sense of touch, okay? I'm gonna be touching your face with these gloves. They might squeak a little, so sorry for that. Now I want you to pay attention on how do you feel my hands touching on your face. Do you feel that? What about this? Perfect. Can you feel me touching right there? How about right here on the tip of your nose? Good. Alright. Perfect. Down your cheeks. Great. Now, let me know if anything feels uncomfortable. I'm going to start pressing just a little bit every now and then, okay, on your face. Okay. Okay. From what I can see, there is no extra sensitivity. Perfect. Now, can you smile for me? A big, big smile. Okay, can you frown? Okay, can you raise your eyebrows? Good. One last thing before we move on. I'd like you to puff your cheeks, okay? And I'm going to press gently on your cheeks, but I want you to hold up as much air as you can, okay? Okay. Firmly. Like that. Alright, perfect. Great. So no numbness. Muscle tone is even. That is perfect. The last thing that I want to do is check the sense of smell. Okay, so I have 2 bottles right here. They smell different. You should be able to tell what the smell is, okay? Don't worry, it's something very common. So, I want you to cover one of your nostrils, and I'm just going to hold this up so you can smell it, okay? Smell that. Now, can you tell me what that is? Vanilla, perfect. Let's move to the next one. Cover your nostril, please. Now can you tell me, what does this smell like? Cinnamon. Beautiful, good nose. Perfect. Alright. And for the test smell, don't worry, I'm not gonna make you taste anything. Can you just open your mouth and say for me? Wide, okay, just checking the nerves responsible with that. Can you stick your tongue out? Alright, that's looking fine. Okay. Your tongue looks healthy. Now, can you press on the sides of your cheeks with your tongue? Alright. Just a little bit more. Okay. Perfect. Let me look at the results. Thank you for trusting me today. That's it. All your cranial nerves are working beautifully. Well, I guess I'll see you again soon.